Good evening, ladies and gentlemen. I'm Katyayani, your host for today. I welcome you all to yet another episode of our ongoing series of discussions on arthritis in India to mark Bone and Joint Health Awareness Month. We would also like to thank Pfizer India for helping us put this session together. I would like to welcome our distinguished panelists for today, Dr. Shallu Verma, who is consultant rheumatology, Metro Heart Institute with Multispecialty, Faridabad. And we have with us Dr. Amit Agarwal, Senior Consultant Orthopaedic Surgery, Indraprastha Apollo Hospitals, Delhi. Welcome, Dr. Amit. Welcome, Dr. Shallu. Thank you so much for taking out the time.
Yeah, thank you.
Right. So, arthritis is, such a prevalent issue today. Around 23.46 million individuals in India have had arthritis in 1990, and the numbers have increased to 62.35 million in 2019. So the burden and impact of arthritis in India is substantial and is increasing every single day. And it is very important to adopt suitable control and preventive community measures to reduce the modifiable risk factors that are needed to reduce the current and future burden of arthritis in India. On that note, I would like to start with the questions. My first question to Dr. Amit. Dr. Amit, if you could enlighten our audience about what is arthritis and what are the different types of arthritis and what is their prevalence in India?
Yeah, arthritis is a very common health condition that affects the joint and it leads to the pain, swelling, stiffness, and decreased range of motion. So it could be multifactorial. Any issues, any pain, any suffering, it can lead to arthritis. Like there are various types of arthritis. One is osteoarthritis. This is the most common type of arthritis found not only in India, worldwide. This is the most common, and overall prevalence is around 28.7 according to the recent journal which was published in Indian Journal of Orthopaedics. So the prevalence is this is the most common type, and a description you can say that it's a degenerative type of osteoarthritis. It is quite common in elderly populations, right? The next one is rheumatoid arthritis, and the prevalence is around 0.75%, and it is more common in females compared to males. Third one I would like to discuss about the ankylosing spondylitis, and which is again more common in young males. So this is the difference. The rheumatoid arthritis is common in females, whereas ankylosing spondylitis is more common in young males. The fourth type is gout, which is more common in males, and it has a predilection for big toe. If there is a pain in the big toe, swelling in the big toe, the high chances of patient having a gout. The fourth one is psoriatic arthritis. This is not very common, but then yes, the patient with psoriasis, the skin conditions, they can present with the joint pain, stiffness. So we have to rule out psoriatic arthritis. The another type of arthritis which is quite common in young kids below 16 years of age is juvenile idiopathic arthritis. There are so many sub-variants. I will not go into detail of it, but then yes, they are also quite common in populations. So another type is reactive arthritis. Reactive arthritis is common with the patients presenting with the infection somewhere else in the body. It could be the gut, it could be the urinary symptoms. Followed by that, they will have symptoms in the joint. So reactive arthritis is also one type of arthritis. Another one which is quite common, another autoimmune type of condition is SLE or systemic lupus erythematosus. So this is also quite common in the females, and they can present with the skin malar races, and it's a multifactorial disease. So its prevalence is also not very high, but then yes, it is quite common in females. And it is also important to note that the prevalence of arthritis in India may vary across the different regions and communities, and the overall prevalence of arthritis is increasing overall. You can say it could be because of the multifactorial. One is aging population. The people who are in aging population, they are prone for degenerative osteoarthritis, and the lifestyle changes also. Obesity is getting quite common, and we are not following very healthy lifestyle. All these things are leading to the increase in the prevalence of the various type of arthritis. Yeah. So this is a brief note about the types of arthritis and their prevalence.
Right, sir.
Over.
Thank you so much for answering that. My next question is to Dr. Shallu. Ma'am, if you could just tell us what are the common symptoms of arthritis and what are some key risk factors that are associated with this condition?
Okay. As Dr. Amit has already mentioned few types of arthritis, I would just like to join and just elaborate a bit like what are the risk factors for it and how do we actually recognize the arthritis, that whether it's inflammatory arthritis or degenerative arthritis. So if we broadly categorize arthritis are mainly of two varieties. One is inflammatory, in which we have like ankylosing spondylitis, rheumatoid arthritis, gout, SLE, scleroderma, and various other varieties of arthritis are there. Broadly, there are around 120 varieties of inflammatory arthritis. Other one is degenerative arthritis or non-inflammatory arthritis. So, inflammatory arthritis, most commonly rheumatoid arthritis, is generally seen in young males or females as well. Females, most commonly it's seen, but mainly in the young category. So, the symptoms which they usually present with is when they get up in the morning, they feel a lot of stiffness in the small joints of hands, especially in like these small joints of hands, as well as the wrist, the small joints of feet. So they feel very much of stiffness in the morning. They are not able to do their routine activities for at least half an hour. And once they start with their day activities, their pain and stiffness subsides gradually. Over the time, the joints also show swelling in the various areas where the swelling can lead to deformities if it's not treated well on time. Then other varieties of arthritis have different other kinds of symptoms, such as in ankylosing spondylitis, there'll be inflammatory back pain. In the lower area, they'll have a lot of stiffness when they get up in the morning. In the night, if they take turns or shift from one side to another, it will be very tough for them. So, and over the time, if they don't take proper treatment of ankylosing spondylitis, then their back tends to stoop forward, and the neck also gets stiffness, and they are not able to do any kind of neck movement. Especially in males, it can be really devastating because it's in the young age group. So, stiffness will be so bad that they're just not able to do any of their routine activities. Other than spine, it can also involve their other joints also, like similar to rheumatoid arthritis. So they'll have deformities in the hands, deformities in the lower limbs, as well as back. And like in lupus also, lupus is a multi-speciality disorder in which any kind of system can get involved. It's an autoimmune disease. But as we're talking mostly about the joints today, so the presentation of joints will be something similar to rheumatoid arthritis, but it's most commonly seen in females. Along with the joints, it can also involve the skin, it can also involve liver, kidney, lungs, any body system of the person can get involved in this. So the main symptoms how person can recognize that they can have inflammatory arthritis is early morning stiffness. Pain will subside when they start exercising. The pain gradually subsides, but if they go on taking rest or they take rest even in the afternoon, the pain recurs again. Then they can have deformities, they can have swelling in the joint, they can have some skin manifestations like in psoriasis, they'll have psoriatic like lesions. In lupus, they can have malar rash, which can get exaggerated when they go out in skin. Even in rheumatoid, they can have some kind of skin manifestation like erythema nodosum, kind of skin lesions can be there. Even in sarcoid, they can have skin lesions. In Sjogren syndrome, they can have skin lesions along with joints involvement. So, broadly categorizing, yes, small joint involvement, early morning stiffness, and pains which get better with exercises. This is how we can easily assess that yes, it's an inflammatory arthritis and should be uh, taking treatment very soon. And if it comes to risk factors, do you want me to mention the risk factors?
Yes, yes, please, please. Yes.
Yeah. So the when it comes to autoimmune diseases, inflammatory arthritis broadly saying, so there are various risk factors. The most common because it's a young age group disease, so lifestyle plays a very important role. especially in women, obesity plays a very big role because with obesity, the kind of inflammation, the inflammatory cytokines are already in excess in the body. So, obesity is a very big risk factor for these inflammatory arthritis. Then, definitely genetics. If any one of the family members have any kind of inflammatory arthritis, then chances to develop these kind of arthritis in the siblings or in their kids is quite high as compared to general population. Uh, then lifestyle changes, like a person who is smoking a lot also plays a very big role, especially in rheumatoid arthritis and ankylosing spondylitis. Smoking plays a very big role. It also creates few of the genes like anti-CCP. It's quite high if the person is smoking, and even the lot of treatment options which are available. If a person is smoking, then that treatment also doesn't work very efficiently if the person is smoking along with the treatment. So smoking is a very big risk factor. Then lack of any kind of exercises, sedentary lifestyle, that also causes increase in chances of arthritis. Uh, yeah, these are the risk factors broadly saying that which can cause inflammatory arthritis in people and actually increasing the risk of inflammatory arthritis. And now, even after COVID, because of genetic modifications, which COVID has established quite a lot, so that also caused the incidence of inflammatory arthritis in a very big rise. Yeah, thank you.
Yeah. Can I add
Thank you
few?
so much. Yeah, please go
Yeah,
ahead.
very nicely elaborated by Dr. Shallu. Just
Yeah,
few points for a layman. You don't have to get confused into inflammatory, and because we have already discussed so many varieties of arthritis. So the viewer who are very ordinary laymen will get confused that there are so many specific type of arthritis. You don't have to bother about those things. Whenever you have any joint pain, swelling, stiffness, deformity, morning stiffness, you just need to consult your doctor. That's it. Because you cannot diagnose on your own. So better to consult your doctor at the earliest whenever you get this type of symptoms. Any persistent pain, swelling, stiffness, these are the basic symptoms, right? So this is the kind of take-home message for a ordinary
right,
listener, uh, for a patient who is listening, that they need to consult because there could be some underlying pathology going on in your joint. And why is it important to consult early? Because if you ignore it, we have seen patients ignoring the pathology for a very long period of time, and they eventually damage their joint, and eventually it's a long term implications. So to consult a doctor immediately is important. They can further
right.
investigate.
Absolutely right. I think thank you, Dr. Shalu, for that very elaborative answer, and thank you, Dr. Amit, for summing it up for our public. Because oftentimes we ignore our body, the signs that our body gives us, which leads to further complications. So my next question is to Dr. Amit. So if you could tell us how does early diagnosis impact the overall treatment outcomes for individuals with arthritis?
So, right, early diagnosis is always good, not only for arthritis in any disease, because as the disease progresses, the chances of complications are very high, especially in arthritis. A lot of things are at stake. Your cartilage, which is the smooth surface of a joint, they are very prone for wear and tear. If you don't diagnose it early, suppose in rheumatoid arthritis, there are so many wonderful drugs nowadays. There are disease modifying drugs. There are so many things going on. Biologics are there. So if you start them early, you almost the patient can live a normal life. But then if you ignore them over a period of time, they will develop the deformities. The quality of life will get hampered, and eventually they might require surgical options like hip and knee replacements. So we don't want to go to that stage. That is why it's very important that you diagnose them early. The another important advantage is, when you live with this chronic type of disease, you tend to develop so many other side effects like mental trauma. It's a difficult to live with this type of chronic pathology. You can develop depression and so and so forth. So you need to diagnose them early so that they can be brought back to a normal life, normal social life, right?
Dr. Shallu, if you'd like to add something to
Yeah,
that.
I just want to add on this thing. For inflammatory arthritis, like specifically rheumatoid arthritis and lupus, we have to be very sure that people have to be very aware. It's not only the joints that get involved. Over the time, other systems of our body will also get involved. Like in rheumatoid arthritis, lung involvement is very common, which is in the form of ILD, in which आम भाषा में कहें तो lungs सुकड़ जाते हैं जिसे हम कहते हैं ILD कहा जाता है इसे. So that involvement is very common if rheumatoid arthritis is not treated on time or if not treated well. And similarly, in ankylosing spondylitis, eye involvement is very common, which is in the form of uveitis. So if recurrent uveitis is happening, that can finally lead to blindness in that eye. Even similarly in SLE, if the disease is not treated early, that it can get involved. It can also involve kidneys that will be named as lupus nephritis, which is a kind of a dead end disease. So it has to be treated early. Even it can involve lungs, it can involve heart. So cardiomyopathies are very, very common in lupus. So my thing is ki if anyone has doubt of any kind of inflammatory arthritis, so definitely it has to be treated early. And one very good thing about these diseases, especially rheumatoid arthritis, is that the first 3 weeks of the disease is called the window period of the treatment. If a patient comes in the first 3 weeks and diagnosed very early and immediately started on DMARDs, then 40% of the patients can get into remission. Remission is a term which we use if patient's disease is completely back to normal, or we can say patient gets completely symptom free. And if still patient is taking treatment for quite some time, then 40% of the patients can get rid of any kind of treatment. So, lot of patients have this thing that there's no permanent cure, and that's why people keep running here and there for the treatment. So, if you start the treatment very early, especially in first 3 weeks, and take the treatment with full dedication and do the regular exercises and whatever lifestyle modification is required, and with a positive attitude, then definitely this disease, at least 40% of the patient can get rid of this disease. So yes, early treatment is very, very important that way. And even the various other deformities and various other system involvement can also be reduced. The chances of getting those symptoms will also be reduced.
So, Dr. Shalu, like you mentioned, that a lot of times some of these forms of arthritis can affect other body parts as well, other organs.
Yeah.
So, how
Mm.
do we differentiate, let's say, whether it is a part of arthritis or it is some, other ailment of that particular organ?
See, it's a nice question, and I would like to add that 90% of the patients have joint involvement as the first symptom. So, most of the time, they'll come up with early morning stiffness, joint pains, swelling, deformities. Along with this, they have extra articular manifestations. Extra articular means other than the joint involvement, there'll be
Right.
some other system involvement. So, if
Right.
anyone has rheumatoid arthritis and he's having persistent cough or breathing difficulty, or difficulty in walking a bit, then yes, definitely we should mention these things to his doctor, and or to a lung specialist if they are saying, and they should say and they should tell them that they have rheumatoid arthritis kind of disease. And even if the person has ankylosing spondylitis, so definitely they will have inflammatory back pain, and they'll have joint involvement. Other than that,
Right.
they might have eye involvement or uveitis. But yes, this is 90% of the manifestations. In 10% of the cases, they won't have any kind of joint involvement. The only thing they would have is lung involvement or eye involvement or involvement. Then that
Okay.
case, the doctor will definitely diagnose this like a eye specialist. They will get to know with the examination that they have uveitis, which is an autoimmune variety of uveitis. So they will
Right.
refer that person to a concerned specialist or a rheumatologist or someone. So that eye condition has to be associated and seen that they might have some other kind of ankylosing spondylitis features as well.
So they
So
will
yeah.
Right.
report to the respective doctors. Like the patient with the lung symptoms, he will go to the pulmonologist, the lung specialist. then they
Right.
and they will rule out because he doesn't have any joint symptoms. So initially,
Right.
obviously, it's a very nice question actually, because initially it will be very confusing. There are so many things, differential diagnosis will be there. So they will rule out first very common things, and then eventually they will come to know that yes, this is the missing link actually. Similarly, as Dr. Shallu said, that recurrent uveitis, they may present with opthal side or eye side, and eventually if they are not going to find anything, then this could be one of the possibilities. So this is how it is actually. Sometimes the patient with SLE, they will directly go to the nephro side because of the kidney involvement. So then they will do the biopsy and then they will find out, and later on they might present with the joint symptom as well.
So yes,
Right.
sometimes definitely sometimes a lot of multi-specialty doctors have to
Yes.
be involved in the proper care of the patient, because it depends what kind of involvement they have, what is the severity of the disease. So yes, the patient has to go to few other doctors as well.
Yeah. So inflammatory disease, they are mostly multifactorial, multi-organ involvement is there. So
Right.
multi-specialty involvement would be required at some
Yeah,
point of.
that's true.
Right. Thank you so much, both of you all, for answering that question.
Yeah.
My next question is to Dr. Amit. Sir, if you could share some effective strategies for managing arthritis, including both medical, approaches and lifestyle approaches as well.
Yeah. First and foremost, I would like to emphasize upon patient education actually. Because patient has to live with the disease. We know enough, but then if you're not able to teach the patients, he will be misguided, because most of these are chronic diseases. They will take the medicine for a month or two and they will think that they are already cured. So they will not continue the treatment or lifestyle modification. So this is very important to teach them the type of arthritis, what are the long-term prognosis, and what lifestyle modification required to maintain the remission stage. So all these things are very important. And then coming to medicines, there are so many disease-modifying drugs which are available nowadays. So with very good results. So I'm not going to go in details of the medical part, but then apart from this disease-modifying, there are biological treatments which are available in tablets as well as injectable form. Again, they are very effective with very minimal side effect. They can be used. Apart from that, they are like, if you talk about degenerative osteoarthritis, there are intra-articular injections like hyaluronic acid or mesenchymal stem cells can be given, PRPs, growth factors, corticosteroid injections also intra-articular can be given. These are intra-articular injections which directly delivered inside the joint, and they are more effective than the oral medications. So these are few options. Apart from that, physical therapy also is very important, like some set of exercises which can be uh, done to increase the strength of the muscles which are supporting your joints. Like in case of knee, we have to strengthen the thigh muscles. Similarly, you have to figure out the group of muscles which are getting weak because of the arthritis, chronic arthritis, and we have to strengthen them. And there are some braces you can use to support your knee from outside, offloaders are there. And as far as lifestyle modification is concerned, you have to reduce your weight. If you are obese, you have to take care of your diet, take a lot of fresh fruits, vegetables, drink a lot of water. Actually, we know all those things, but then it's sometimes it's difficult to follow. So we have to make them teach that these are the very important aspects of the management. It's not only the medicines, but this as a whole, it should be a holistic approach, and multi system involvement, multi specialty involvement should be there. And that includes sometimes occupational therapist, physical therapist, the orthotics guys, they can also help. And sometime in chronic cases, I said, they may have a chronic mental disturbance like depression and all those things, anxiety, and stress is also sometimes very important factor which aggravates this inflammatory arthritis. So we must address these factors as well.
I would just like to add on. He's rightly mentioned most of the aspects, like very rightly, that yes, it's a multi-speciality disorder, so various doctors have to get involved. Other than medical, surgical facilities also need to be approached. But how I usually do is the regular persistence of the patient. Like first, very important thing because it's a chronic disease, acceptance is very very important along with the family. So family counseling is also very important other than the patient, because most of the time family also is not accepting, especially when it comes to females, and the a lot of burden is given to them. That's a chronic disease, you're not going to get fine, and family support is never there. So yes, family as well as patient counseling together, it should be done every time when they come to the OPD. That's how it's done. And other than the counseling, we have to make them aware that how the disease progresses, like the importance of the early treatment, early interventions, and even the flares that happens in between. Sometimes people think that okay, we are taking the disease treatment for the disease, now they'll get better. But yes, there are a lot of factors which cause the aggravation of the disease in between, causing flare of the disease, and then they totally get disheartened, or sometimes they change the doctors, or they totally stop the treatment as well. So we have to tell them exactly how the disease progresses, and in various aspects, even if they are already taking DMARDs or some any kind of medical treatment. So in between the disease relapses and the diseases are like that, the body tends to do the failure of the disease, and there's a failure of the treatment, and that's how they we need to shift the treatment from one point to other. Like if they are already taking DMARDs, we have to offer them biologics, and definitely biologics are a little expensive treatment as compared to DMARDs. So now there are cheaper options as well, but yes, we have to look for the finances. So as soon as a patient comes of rheumatoid arthritis, I tell them that you should have your medical insurance policies along with you, because in future, if in case we need some expensive treatment, then you should have to have such kind of facilities which just give a financial boost up to the patient. And regular exercises, physiotherapy, motivation, psychological treatments, it's very very important along with the other aspects as well. Yeah. Thank you.
Right. Thank you so much for that answer, Dr. Shalu. My next question is also to you now. So, are there any recent advancement or innovative treatments in arthritis management that you would recommend our viewers and patients out there that they should explore in terms of treatments?
Yeah, actually, treatment is changing very dramatically over the time. There was time when initially there was only painkillers used to be given. Then came gold in the picture, and gold was actually initially given around, say, around 50, 60 years back. Then it totally stopped, and then various other DMARDs were started. But yes, all these DMARDs have their pros and cons. Some people do tolerate some kind of medicine, and some people have some kind of side effects, or they already have some comorbidities like their kidney involvement is there, or some have diabetes. So looking at all the picture, various medical treatment is available for the patient, and 60% of the patients do respond very well to disease modifying drugs. But if they have frequent flares, frequent relapses, and despite of the treatment, we do assess, we keep doing the disease activity index for the patient. There are various parameters. For every time they come, we have to recheck and see whether patient is in remission, is completely fine, or if the disease activity is still going on. So depending on that, there are various biologicals which are coming up, which are different for different kind of arthritis. Like in rheumatoid arthritis is absolutely different. In case of ankylosing spondylitis, there are different kind of varieties. And in case of lupus, because it's a multispecialty disease, then that depends upon the organ involvement which is there. Depending on that, various biological and other treatment options are there. And even if deformities are already set in, then yes, biologicals have to be still given, or treatment has to be still given, so that disease stays in remission. But along with that, there are various corrective surgeries which orthopedicians are very good at. So we do refer our patients to the surgeons. So like knee replacements or hip replacements if it's already deformed. Various intra-articular injections are also there, which help in reducing the disabilities. And along with this, yes, physiotherapists also play a very important role. Then orthopedics are their orthotic departments are there, which give some kind of assistive tools to the patient. Like if they have deformities in the hands, then we have various kinds of splints which help in reducing the deformities and help in making them do their routine activities in a very good way. So, and yes, with the help of psychologists, we keep them, the affirmation is always given to them. Yes, they don't have to get disheartened, and this disease can easily be managed well.
Right. Dr.
Right.
Amit, if you'd like to add something.
Yes. Yes. So apart from inflammatory arthritis, which Dr. Shallu has already explained in very detail, in degenerative arthritis, which is the bigger part, or you can say the big burden on the society, the osteoarthritis, we have recently started giving intra-articular mesenchymal stem cells with very good results. And they are, you can say, the latest upgradation. We are still giving other viscosupplements to increase the lubrication in the joint, and some collagen supplements are also given. And as far as surgery is concerned, we have started doing the robotic total hip and knee replacements with a very good result. The surgical aspects we are not going into detail, but then they have a very good post-op rehabilitation, and the error is very less. So yes, these are the upcoming things, or you can say the latest new addition to our armamentarium.
Right. Thank you so much, Dr. Amit. Dr. Shalu, my question to you next is what coping strategies do you recommend for individuals so that they can manage arthritis in their daily lives?
Can you just please repeat the question?
Yeah. What coping strategies would you recommend for individuals who, are suffering from arthritis? How can they manage arthritis in their daily lives?
Okay. So there are very simple few things which they have to be aware of when they are dealing with arthritis. First and very important thing is just be very aware, be very okay with this thing and accept the fact that it's a chronic disease. Similar to diabetes or any kind of heart ailments or hypothyroidism, the way they keep taking medicines for that. So for this also they have to take treatment regularly, keep showing to their doctors. But yes, after some time the amount of drugs that they are taking, if they're taking it regularly, the amount of drugs, that medicine that they're already taking, it can get reduced. Then exercises play very very important role. It's as important as the medicines. So 1 hour of daily exercises, and in the exercises muscle training is very very important. So I tell all my patients to at least spend 1 hour with themselves along with the exercises, any kind of yoga or meditation that helps in their mental stability, that will also help. And family involvement by for coping up the disease is also very very important with them. So every time they come, I suggest all the family members to sit with the patient and ask them whatever problems they have, so they can come and take the help of a psychologist or discuss with the doctors about how to cope up with this thing. Then other than uh, things like avoiding smoking is very important. Even active and passive, both kind of smoking exposure is really bad for the patient. So they have to stay away from smoking and the zones of smoking definitely. So, and balanced diet is very very important for them. Like especially I would want to mention here that in India there are a lot of myths when it comes to diet. They, most of them, they stop taking curd, they stop taking any citrus fruits कि खट्टा खाने से उनको लगता है कि joints में pain बढ़ जाता है, या they stop taking like vegetables like ladyfinger and few other things, rice also. No, they have this big myth that it increases the joint pain, but that's not how it is. So they should be taking balanced diet, which includes all kind of green vegetables, fruits, and any kind of food which is available at home. They should be taking everything, like all sort of things. So there should not be in daily routine, there should not be such factors which keep telling them on in their head that you are diseased and you have this disease. So don't keep poking this thing in the patient's mind that don't eat this, don't eat that. Just let them live a very natural way of living, and just keep doing regular exercises. That's about it. So nothing. It's not a very chaotic disease or not something to get really disheartened with. So just go with a positive attitude, and can be easily dealt with.
Thank you so much, Dr. Shallu. Dr. Amit, you'd like to add something to it?
Yeah, actually, apart from the patient and the family education, there are so many assisted. You can use some apps nowadays. The wearable apps. They can help you in. We have to teach them that they have to lead a healthy lifestyle. That's it. Don't focus on the disease. Focus on your healthy lifestyle. That's it. If you focus on a healthy lifestyle, eventually the disease will be defeated. You will be the winner. That mindset, the positive mindset, has to be there. And to inculcate that, nowadays we encourage patients to have the apps. So many bands are there, so they can keep a track of their calories burning, and the diet also they can follow very healthy diet. There are so many online support groups also, arthritis foundation and arthritis help care groups, so they can join some of the groups and they can get benefited from others experience. So that is the advantage of new era, you can say. The telemedicine is there. Some people are living in the remote area, they don't have access to the good rheumatologist or orthopedic surgeon, so they can consult online. There are so many things going on nowadays. And because of the internet, we have so many lectures, public lectures, which is available, so they can get benefited. They can gain the knowledge about their disease, and they can get their queries answered in a better way. Compared to 10-15 years back, uh, there are a lot of misconceptions, but nowadays patients, we feel very good that patients are learning. They are sometimes well informed about their disease, so they are coming with the query. So we feel also good that at least they have the basic knowledge. We can teach them further, we can guide them further, right?
Right. Thank you so much, Dr. Amit. My next question again is to you. Sir, do you think arthritis can be prevented? And if yes, then what are the measures that individuals can take so that their risk of developing arthritis is reduced?
Yeah, very good questions, because we always say in medicine that prevention is better than cure. So it's always better that if there is one is risk stratifications. So there are two part. One is modifiable risk factors. Another is non-modifiable risk factors. Like if you are gender, if you talk about gender, females are, we know that, more prone for rheumatoid arthritis. Males are more prone for ankylosing spondylitis. That is one part. Aging, like the more you will age, the chances of osteoarthritis or degenerative osteoarthritis will be there. The third part, your weight, that is a modifiable factor. Gender and age, it's not, you cannot change that. But then weight, yes, weight has a big bearing on the joints. So you should be well aware about your BMI. What is your height and what should be your ideal weight, and try to maintain that plus minus some percentage, but try to maintain your ideal body weight most of the time, so that at least you can reduce the risk. You cannot completely ignore the risk, but at least you can reduce the risk if you maintain your healthy weight. Then diet, if you take a lot of fresh fruits, vegetables, they all have micronutrients. They will definitely help you in coping up that inflammatory process of the body. And other factors are like lifestyle modifications. Like if you are into some occupations wherein it makes you uh, prone for certain type of arthritis, like you're running, jumping, a lot of physical activities involving a lot of pressure on your joints, like then you'll be prone for knee osteoarthritis or hip, depending on, or sometime in the spine you can have a degenerative changes. So you can change that to certain extent, and then you can do regular exercises to strengthen your muscles. That will also lead to the decrease in the prevalence of osteoarthritis in your joints. Yes, so there are a lot of things you can do to prevent the arthritis. And consult your doctor immediately, as Dr. Shalu said, that if you consult in a window period, the results will be good. So these are the factors which a patient should be well aware to reduce the risk factors.
Dr.
Yeah,
Shallu, if
actually,
you'd like
the
to add
way
something. Yeah.
Actually, I think we should be moving back to our Dadi Nani kitchen. The way, I mean, they used to cook food, and they used to just, everyone used to eat simple homemade food, And we used to walk a lot, like going to school or going to nearby markets, never used to carry a bike or a car or something. And so these things actually really help if we inculcate these practices in our kids from childhood, like every day 1.5 hours of exercises and good homemade food. If such simple practices are inculcated in every family, then chances of getting all these kind of diseases are very less, especially if someone has any kind of disease in the family and we know that it's a genetic trait. And genetic doesn't mean that everyone will have this disease, it's just the chances are little high as compared to a normal population. So their family members should be really aware and uh, should have a check on their weight and should have a check on their diet, and especially no to smoking. Smoking, as I already mentioned, has a very big role in developing arthritis. And even women who have PCOD, or even if you have diabetes or hypothyroidism, then chances of developing joint ailments are even higher because of those diseases also. So if you have any kind of such comorbidities like diabetes, thyroid, blood pressure, so take care of those diseases and stay in touch with your doctors for such ailments as well.
Right. Thank you so much, Dr. Shallu. I'll try to wrap up. If you could just give us one message that you'd like to give our viewers. Dr. Amit, we'll start with you. Any closing remarks, message that you'd like to give to our viewers?
Yeah, so arthritis is just like any other disease, right? So you don't have to get afraid of it. You should understand about the type of arthritis. As a patient, you should be well read about what are the symptoms and what are the things you can do on a daily basis to reduce the load of the disease on your life. Simple lifestyle changes can be incorporated. uh, Maintain your healthy weight, maintain healthy lifestyle, diet, no smoking, avoid alcohol, all those things. We all know all these things, but then for arthritis patient it is even more important to follow these things, right? And consult your healthcare, and don't ignore your symptoms. Sometimes they think that it is just like that chalta type of attitude. Take it seriously, because your joints, it's not only about your joints as a whole, it's very important to keep you mobile. And take home message is, yes, consult your healthcare professional in case you have any doubt, any symptoms which are not resolving over a period of time, right?
Dr. Shallu, parting
Yeah.
remarks from you as well.
Okay, actually Arthritis Awareness Week is going on. So मैं यही कहना चाहती हूँ सभी पेशेंट से और आम लोगों से भी, अपने शरीर को लेकर जागरूक रहना चाहिए, बहुत ज्यादा जरूरी है। कभी भी आपको लगे कुछ भी ऐसा प्रॉब्लम हो रहा है जो आपको परेशान कर रहा है और रूटीन कुछ भी घर की चीजों से नहीं ठीक हो रहा है, तो डेफिनेटली अपने जो भी आपके हेल्थ स्पेशलिस्ट हैं या जिनके पास आप सबसे पहले जाते हैं, उन्हें जरूर दिखाना चाहिए। और अगर उनसे भी नहीं आराम आ रहा तो किसी और स्पेशलिस्ट को एक बार वापस जरूर दिखाना चाहिए टिल द टाइम यू आर सेटिस्फाइड। अपने डेली रूटीन में हमेशा एक पॉजिटिव एटीट्यूड रखिए, क्योंकि आधी से ज्यादा प्रॉब्लम्स एक अच्छे माइंडसेट के साथ ही ठीक हो जाती हैं। बहुत सी डिजीजेस होती हैं जैसे फाइब्रोमाइल्जिया है, जिसमें सिर्फ जॉइंट पेन्स होते रहते हैं बट कोई डिजीज नहीं है, बट इट्स एक्चुअली बिकॉज ऑफ आवर माइंडसेट। तो लेडीज को खासकर कह रही हूँ, वो बहुत ज्यादा परेशान रहती हैं घर में कि कोई ध्यान नहीं दे रहा या सब काम बहुत करना पड़ता है, थिंग्स लाइक दैट। सो एक पॉजिटिव अप्रोच रखिए, अपने लिए टाइम जरूर निकालिए, बिकॉज आई थिंक हमारा बॉडी और हम खुद अपनी सबसे बड़ी रिस्पॉन्सिबिलिटी है। बाकी तो डॉक्टर अमित ने भी जैसे बताया, यस फॉर एनी एनी काइंड ऑफ सिम्टम जिसमें आपको लगे कि आर्थराइटिस हो रहा है और डील नहीं हो पा रहा है, तो आपको अपने डॉक्टर के साथ जरूर दिखाना चाहिए। एंड अलॉन्ग विद द मेडिसिन अपना एक अच्छा हेल्दी लाइफस्टाइल, हेल्दी डाइट, रेगुलर एक्सरसाइजेस, इन चीज का जरूर ध्यान रखिए। थैंक यू सो मच।
And prevention is better
Thank you
than
so
cure,
much.
right?
Absolutely. Thank you so much, Dr. Shallu. Thank you so much, Dr. Amit. This was a very interesting session, and I'm sure our viewers have learned a lot. So, thank you so much for joining us. And
My
yeah,
pleasure. Thank you.
Thank you.
Thank you. Bye
thank
bye.
you. Bye.